What are they doing? Okay, I'm personally attacked by that one. Yes, that's all I can say. TikTok. We all spend our time there, but none of us want to admit that. Today, we're going through the funniest gynecology TikToks that I've seen recently. If you're new here and you'd like to subscribe, we would love to have you hit that subscribe button, turn on notifications so you never miss an upload. Let's jump into the video. I will leave this linked below. I have no idea if that's the original creator because I have seen this one reposted everywhere under so many different names. That is hilarious, and I can't even say anything because yes we do.
Hi, I'm your doctor. My name is. Where is it? Where is it? I knew it. Is this yours? Disgusting. So gross.
That is so funny. Yes, every person ever who goes to the gynecologist hides their underwear under their pants. I do this too, and I also don't know why, because I have never, not once, looked for or noticed where someone's underwear are sitting when I come into the room. Literally not once, unless they're still on you and you're here to have an exam.
This is not English. If you're not in medicine, try reading this. What do you think this means?
Okay, I'm gonna read it and tell you what it actually means, and then we'll see what he says. 77-year-old male complains of shortness of breath, status post, pericardial, I don't know what PCI is. Percutaneous, I don't know that one. Must not be in my field. They do say 77-year-old male, so outside of my scope. Past medical history. Yeah, I don't know that one either. Something. Type 2 diabetes, hypertension, and coronary artery disease. Okay, now I'm really bothered by the two that I don't know. All right, I've got to search this up. Percutaneous coronary intervention. Hey, I was pretty close with my guesses. And high frequency reduced end diastolic flow, but I don't know what that actually means. Heart failure with reduced ejection fraction. Yeah, I got that. All right. So that's what it means. 77-year-old male complains of shortness of breath, status post, percutaneous coronary intervention, past medical history, heart failure with, what did they say? Reduced ejection fraction. That means his heart's not working well. Type 2 diabetes, hypertension, and coronary artery disease. Okay, now that I have shown you all how much I am pigeonholed into exactly what I do, let's see what he has to say.
77-year-old male came over, son of a bitch, salt and pepper, penis clean-ish, performed Macarena. His heart froze, really excited for this to determine my heart tickler's necessity. Could have already died.
Oh my god, that was so funny. Why was that so funny? Oh my gosh, that was so funny. Thank you, Karen, my production manager who tracked all these down for me, for sending that one, even though it wasn't necessarily in the gynae space. People always make TikToks like this, and it's absolutely true. If you're not new here, you know I reuse my jokes because I only have 3, and those are the ones I use. So my joke for this is telling people that I think I should just write one more little scoot down this way on the ceiling above my exam tables, because that's what I'm always telling people. However, I will say, the reason that we do this is because if you are all the way at the edge of the bed, like your bum cheeks hanging off the edge a little bit, it makes the exam much easier to do and much less uncomfortable. It's because of the positioning of the pelvis, but I promise we're doing it for you. We want to make the exam as comfortable and quick as possible, and that is one way that we can do it and ensure that we have the easiest and quickest visualization of the cervix. So that's why we do it, but I do understand why it is so annoying and awkward.
When the external cephalic version fails and your doctor tries an alternative method.
I am so confused. What are they doing? The context of this TikTok, if you don't know, is a breech baby. So it's bottom down instead of head down, and they want it to turn. They've done an external cephalic version, which is where we use our hands on the tummy to try to turn the baby to a head down position, and that didn't work. And now they are doing that? Why? What? I'm so confused. I've never seen this technique. If you are an OB-GYN or midwife out there and you know what this is and what the success rate is, then let me know, because it's new to me. I want to read through the comments. Someone said, did it work? No, I had to have a C-section anyway. Shocking. That's a great doctor. We need more like him. Too many are in a hurry to try this sort of thing. Okay, I'm going to take a little bit of contention with that one, because I don't know that I've ever been in too much of a hurry to try this, right? It's not just like, if you don't just do random things that aren't backed by evidence, you're in too big of a hurry. Like, if this is a technique that has some likelihood of working, then sure, we should try it. But I'm not sure that it's because we're in too much of a hurry. It might be because that's not something most of us have ever seen described as an effective way of making a baby turn.
Hi, we're just gonna do a PAP today. Are we sexually active? We are, okay, and what contraceptives are we using? The pull-out method? Okay, well, didn't work for my daughter, but... Oh, you already gave us a urine sample? Okay, great, okay. Oh!
Why is this me? Oh no, I hate it.
Okay, it's a little dark. Forward, Keep going. All right, are you drinking water? You need to drink more water, okay? Ice in your coffee doesn't count. Right, scooch forward.
Okay, I'm personally attacked by that one.
One more little scoot down this way.
Scooch forward. Tina, yeah, hi. Can we get a pregnancy test? Yeah, let's just to be safe, let's get a pregnancy test. Oh, also Tina, can we also get a test for BB as well? Yeah, I think I see a little vaginosis going on. Yeah.
Oh no, I hate that it looks like this, but what else are we supposed to do? We have to ask for help. Isn't that better than just leaving you there and going and getting things ourselves?
Forward. You know where the edge of this bed is? Yeah, that should be in the middle of your back. That's how forward you should be. Okay, I have a little goodie bag here for you. I know we all love the pull-out method, but I put some condoms in there as well, okay? I think it'll work out for you a bit better. I also put a coupon in there for boric acid pills. I want you to try those out and then get back to me. I also put a couple coupons in there for water, okay? I need you to be drinking it. I need you to be drinking way more of that water, okay?
Oh, that's so funny. Yeah, pull-out method is not very effective. Probably 60%. So not, I don't know. I could be wrong. Let me look up the actual effectiveness rate. We do have studies on this. 75%. There you go. That means over the course of the year, 1 in 4 people who are using this as their only form of contraception will end up with an undesired pregnancy. So, you're allowed to take the risk that you want to take. Condoms, about 88% effective with typical use, and other things like birth control pills are going to be much more effective. Now, she does mention something called boric acid pills. Boric acid suppositories can be used for recurrent bacterial vaginosis, but I think it's really important that I say that because, one, it's not the right thing for everyone and it won't treat everything, but also boric acid is not a pill. It is a suppository. It goes in the vagina. If you take those orally, they can kill you. Very bad for you. Please don't take them as pills. So I know she didn't mean it like that in a negative way. Actually, she's one of the funniest creators that does things in the reproductive health space, and I love her videos, but boric acid, not pills. Please don't take them by mouth.
So, who broke it? I'm not mad. I just want to know.
I did. I broke it.
No, you didn't. Tom?
Don't look at me. Look at Ben.
What? I didn't break it.
Huh, that's weird. How'd you even know it was broken?
Because it's sitting right in front of us and it's broken.
Suspicious.
No, it's not.
If it matters. Probably not, but April was the last one to use it.
Liar, I don't even drink that crap.
Oh, really? Then what were you doing by the coffee cart earlier?
I used the wooden stirrer to push back my cuticles. Everyone knows that,
Okay,
Jerry.
okay, let's not fight. I broke it. Let me pay for it, Ron.
No. Who broke it?
Ron, Don has been awfully quiet.
Really?
Yeah, really.
I broke it. It burned my hand, so I punched it.
Yes, 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 yes. That's all I can say. From out here in socialized medicine world, it is not perfect here, but I can tell you 100% as far as my ability to be mentally healthy and my ability to effectively care for patients by giving them the treatments that they need and taking care of them in the way that they need to be cared for. American healthcare is broken. There are certainly some things that are not ideal in every system, and I certainly think that there are people who live in New Zealand who would say that this healthcare system is also broken, and I could agree with that on some points, but the way that American healthcare works, where so many people are so money focused, where insurances can control your ability to access your healthcare, where your insurance, meaning your ability to get healthcare, is tied to your job. So you get sick enough to be fired from your job because you can't show up, you also lose your healthcare access. These things are fundamental problems with the American healthcare system, and I think are reasons that we have outcomes that are so much worse compared to places that should have pretty similar outcomes to us. So yeah, that's my tangent for the day. This is a good one, but it's a little bit too real.
Like, not a fan of the way it feels, so let's just go with that, yeah? Because you've had a vasectomy before, right? What? Seriously? Oh my god. Why not? No, it's fine. It's fine. It's just every guy that I've ever been with has had one since they were 14. I'm just like, why are you so careless? Frankly, I find that really unattractive, like really off-putting. I don't know if I want to do this anymore. I mean, I will, don't get me wrong. I'm just not happy about it. Actually, you know what? You let me know once you get snip-snapped. And for today, you can just... I'll accept that.
Okay, I am just gonna be very honest and say that you shouldn't be interacting with guys who act like that, so wash your hands of that attitude. Texting my former co-residents to verify that the medical decision I am making makes sense, because even though we did 4 years of residency and passed board exams and are deemed safe to practice independently, we still feel like we need a little confirmation that what we are doing is correct. Yeah, I definitely feel that. And I actually know her. She's a lovely person. You can go follow her on Paging Dr. Fran, I think is her moniker on social media. But she's really wonderful. I think she's relatively new out of training, and I definitely remember that feeling, like getting out of training, you're finally like on your own. And I remember looking around in an emergency situation and thinking, it's me. It's me they're waiting on to fix this. And it is really intimidating. But even down to like the little decisions, just texting a friend from residency and being like, hey, if you had a patient with XYZ, is this what you would do? Just need like a little bit of moral support here. It does get better. It gets easier with time and you get more confident in what you're doing, but it's scary. It's scary getting out on your own. Even if you know that you are well trained, have the skills, you're board certified, all of those things, like it's still so intimidating. I don't know if you learned anything today, but I hope at least you got a laugh, because I know I was very much in need of a laugh today, and I hope that you were too. If you're new and you'd like to subscribe, I talk about all things periods, pregnancy, and everything in between. Hit that subscribe button, turn on notifications so you never miss an upload. I'll see you next Monday.